Hey everyone, my name is Kelly Reed and I am a physical therapist and I specialize in oncology and lymphedema. Today I'm going to go through my full routine on manual lymph drainage for the upper extremity. I will be doing different videos for left arm lymphedema versus right arm lymphedema versus left leg and right leg. So try to find the video that works best for you. This video is going to address left arm lymphedema and how I would do manual lymph drainage step by step through the full sequence. I am going to wear a wristband or a hair tie on my left wrist to help you remember what arm I'm working on. Manual lymph drainage is a light massage technique to help move and support the lymphatic system to get fluid moving out of a limb or an area that is affected. Manual lymph drainage is not just used for lymphedema, it's also used to help move other swelling or other edema, improve the immune system, reduce stress, reduce fatigue, reduce heaviness, and improve skin swelling or skin tissue. So we're going to start for the lymphedema in the left arm. First, we're going to do belly breathing. So what I do is put your hand on the abdominal wall. Think about your abdomen in 4 quadrants. We're going to do 1 breath in each quadrant, placing your hand down on your belly and pressing in moderately. You take that deep breath in, feel yourself expand into your hand, and then out. And as you push out, I want you to push a little bit deeper down with your hand. You want to put some compression into your abdominal wall. So breathe in and out. And third. And last one. Good. And then I'm going to come up to my neck and my head neck lymph nodes, and you could have done that first. I just like to do the belly first. So your lymph nodes are underneath your jawline and also around your clavicle bone here. So I usually will separate my fingers around my ears and do circles. Now if I feel like I'm getting sick or starting to get a cold, I'll spend a lot of time also under the jaw area lymph nodes, gently massaging to help stimulate these lymph nodes. So again, you can do both arms at the same time if you're comfortable with that. And you can spend more time on a certain area, that is just fine. I usually again spend about 8 to 10 cycles or 8 to 10 circles in each area. And then same with the clavicle, so I'm going to cross my hands and gently make circles at the base of the neck. Good. And then we want to think about getting the lymph fluid from this arm, if this is our affected arm, out of the area, especially if you've had lymph nodes removed or this area is compromised. So we're going to try to get the fluid moving down to the left groin or across the body to the right armpit. So I'm going to stimulate those lymph nodes in those areas first. So I would do the groin, you put your hand flat about where the crease is, and you're going to just do circles in the left groin. Does not matter what direction you do your circles in, just nice and gentle. And nice big large circles. Avoid using just your fingertips, try to use your full hand. And then the armpit, so here. Good. And so then we're going to try to move the fluid or stimulate the fluid moving across. We do want to try to open up these pathways, because if we're trying to get the fluid moving out of the arm, if there's fluid sitting here, it's going to get blocked. So we do want to release and move this fluid first. So you do have anastomosis here, which is what means where the fluid can come from one side to the other. And so I'm going to stimulate the inside or the middle of the chest. And then what I'm going to do is I'm going to gently pull or push the fluid across. You can also move across this way. I try to keep that arm relaxed. So I'm gonna pull across. And what it is, it's a gentle stretch and let go. Gentle stretch and let go. And so I'm not moving back and forth on my skin. I'm gently pulling and then releasing. You can also do circles, so pushing and release, push and release, circle and release, all the way across. Whatever technique's work best, you're just trying to feel like you're moving the fluid and pulling the fluid across. I usually do about 3 to 5 across and 3 to 5 down. So anastomosis is about where the belly button runs, and it's more on the side. So I'm going to stimulate that side first. And then I'm going to gently scoop and pull down the side. I'm doing small circles. You can also just do straight pulls, stretch, and release. And is best on skin directly when you have the option to do so. Now for those who've had radiation in the area or have chest wall lymphedema, you do want to spend a little bit more time in this chest wall to get the fluid moving first. If you do have swelling in the breast as well, you can also work on bringing this out and about or out to the side and then down again out of the area. And then I'm going to go back and we're going to start with the arm. So I'm going to stimulate the lymph nodes in that affected arm if that is where the lymphedema is. So nice and gentle, large circles, 8 to 10. And then what I want to do next is I want to think of the arm into 3 to 4 different quadrants or sections. So I'm going to spend a little time on the shoulder, and then I'm going to go to the upper arm, and then the forearm, and then the hand and fingers. And you want to start with each, making your way down, and then we'll go back up the other way, again to clear out the more proximal or the closer areas first, so the more distal or further areas away can then have a place to move towards. So starting with the shoulder, making sure you try to get from the back side of the shoulder too. You're going to try to scoop that up and out of the arm. And then I'm going to try to go and down to the upper arm, and try to make sure you get the back and the front. So small circles all the way up, or you can do kind of a push and pull, push and then release, push and release all the way up. Whatever works best for you. Now I'm going to focus more in the areas that have more fluid. So if you notice most of your fluid is in this part of the arm, I'd spend a little bit more than those 8 to 10 times across in that. Again, if you also have fibrosis, so you've had fluid a long time and it's thickened or hardened the area, then I would also add a new technique where I will go in and gently think about massaging dough. So I'll gently pick up the tissue and roll the tissue a little bit deeper than it was before. That will really help soften the tissue. I'll typically have people spend 2 to 5 minutes on that for that area. If they're doing it on their own. If they're coming to me in the clinic, I may spend a little more time if it's an area they have a hard time reaching, or if it's pretty thick and fluid that might be blocking another part of the fluid from the lower arm moving up. So you can spend a little bit deeper techniques there. And then when you're done with that and you spend a few minutes on that firmer tissue, then go back and finish with your manual lymph drainage techniques, moving that fluid that you may have released or the adhesions that you let go, and get that moving up through it again. You want to make sure that you also get the inside. So again, as you do it, you feel if you have any firmer, or I tend to just say it's more of a lumpy area. That tends to be more of a fibrotic tissue. So you find those, and as you find them as you go along, you're just going to spend a little bit more time working through those areas. Now this is an option to do laying down, so you can have your arm up above you and have gravity help assist you. That may make it a little bit easier. I'm typically just having you upright just to show you for the video. And then when you want to come down to your elbow and make sure you get the front of your elbow crease. It circles up and release as you go up and release. And then also making sure you get around the elbow and the back, around those bony areas. I tend to use my fingers a little bit more to try to get into those crevices, especially for those who wear a compression garment full time. They don't do a great job of getting in between those bony areas, so you're trying to use more fingers to get into those crevices. And then I'm going to come to the forearm. So I'm going to help gravity, so I'm going to have my arm up, and I'm going to start just to work the fluid down the arm. And then the other side. Can you find what works for you as far as technique? You can do your circles, you can do your stretch and release. Then try to just use your entire hand rather than just part of your finger, so you can get more surface area as you do your lymph drainage. So do a few in each direction. Now at this point you can work back up to the arm. I typically will go down to the hand and then make my way all the way back up. So for the hand, I start with the whole hand on the palm or on the dorsum of the hand, the back of the hand, and just circles. But again, this tends to be an area that has more fluid that can be a little bit stubborn because of all the tendons and areas for the fluid to sit. So after I do some full hand, I'll go in with my fingers in between those tendons and spend time working them out, especially for my patients and my clients. Between the web spaces, I'll kind of get my fingers in between and work around the joints, as well as the other finger joints. I'll kind of get in between the web spaces and go through. If someone has more fluid around one or two fingers, which is common to see, I will just spend a lot more time in those areas just trying to get the fluid to work out. And then you can go into each finger. So I try to just encompass the entire finger. I see a lot of lymphatic vessels run on the sides of the fingers, so I try to make sure I get those as well. I'll even try to think about almost pinching the skin up away from the finger as I do it to try to get some negative pressure, which you can see more about negative pressure release with the kinesio tape video I have. Finger here. Now I see a lot of arthritis as well with lymphedema, and so another reason just to spend a little bit more time in the fingers if they cause you issues. Okay, so as you finish and get all the way down to the hand, then we're gonna make our way back up in reverse. So I'm gonna go back to the hand to get the fluid that I just moved out of the fingers. Probably spend a little more time in between the spaces of the tendons. And typically you don't swell on the palm of the hand, top of the front of the hand, so you don't have to spend as much time there. But sometimes it's just easy just to do both sides, and that's fine. And then we'll make our way down to the wrist. And then down into the forearm. So small circles or pull and release all the way down. So again, you can make this a little bit of your own. If you have a really stubborn area of fluid, just spend more time on that area. If some area is not as bad, then I usually will still do it, but not spend as much or as many strokes down. But again, I typically really like to work into the areas that have more fibrosis for those who have that thickening, as we really want to work to soften that. And I feel like with a little bit of hands-on work, it's pretty easy to help manage that fibrosis, which will help get the fluid moving a little bit better, but also give you more motion and avoid as much skin breakdown or skin issues. I'm going down to the elbow, and then the front of the elbow, You do have lymph nodes in this area. And then up the arm. Again, at this point, I'd probably have my arm raised or laying down to gravity assist. Back up the sides. So you 3 to 5 in each swipe on the way up. You can do 8 to 10 on the areas that are more stubborn. It really is individualized to what you need. And then all the way up on the shoulder. And the front of the shoulder. And then back into the lymph nodes, get those moving. And then what we want to do is I'll finish with trying to get this fluid then moving across or down to the groin area. So I'll go back to pulling across or pushing with the other arm, getting the fluid that you just moved across to the other side. And then down the side, and really try to get the side of the chest wall, not just the front, as the fluid moves a little bit more on the outside of the body, all the way to the groin. Now, if you have both arms affected by lymphedema, you would skip coming across and just focus on moving the fluid down to the side. And then when you've gone through all of the areas to what you want, then I'll finish with a few more belly breaths. So put your hands on your belly again, push in gently, take a deep breath, feel your abdomen expand, and then release, pushing in. And then again. And then a third. And then last one. And that's it. Hopefully that was helpful for you for manual lymph drainage to follow along. Again, I do it a little bit different than some others that I tend to spend more time on a fibrotic area because I feel that's important to soften that area and work on those areas routinely. So I'll spend a little bit more time in a little more moderate technique or a deeper technique, and then going back over with the manual lymph drainage to finish. I feel like that's best just to manage all of your symptoms overall. If you have any other questions or topics you'd like to see covered, feel free to comment those below. Thanks, guys.